Hello, my name is Dr. Ffion Davies, consultant in the emergency department. This short video will take you through what happens when patients arrive at the Leicester Royal Infirmary and how we make sure that the right patients get the right care in the shortest possible time frame. As soon as patients arrive wanting either A&E care or the urgent care centre as it was in the old A&E, they will be booked in by a receptionist and enter a process we call streaming. This is how it works. The right care for a patient may be to go immediately to the resuscitation room, for example if they're having a heart attack, or it may be that they just have a sore throat and don't need any medical treatment. Streaming makes sure that these decisions are taken quickly and no one's time, including the patient's, is wasted. These 10 arrows show how many possible options the streaming team may have for the next stage of the patient's care. Now we'll show you some examples to illustrate this. First, let's just introduce the team that works in the streaming section called the Initial Assessment Zone. We have nurses, healthcare assistants, senior A&E doctors, A&E advanced nurse practitioners, and GPs trained for A&E type work. So here is Priya. She walks in through this door and tells the receptionist she's had earache since yesterday. As soon as she's booked in on the computer system, the nurse working alongside the receptionist shows her to the streaming room, where a GP quickly looks in her ear and reassures her she has a virus and just needs to take paracetamol. Priya is happy with this and goes home 10 minutes later. Sophie has just found out she's pregnant, but today she's had some niggling pain like period pain and has some bleeding. She's really worried. The nurse at reception shows her into the streaming area, where a nurse practitioner or GP can examine her. They can refer her to the gynecology assessment ward straight away, or if they're worried that she might have an ectopic pregnancy and needs a closer look, the streaming team will pass her on to the emergency GP consultation rooms in another part of the department, because the initial assessment zone has to work fast and spend less than 15 minutes with patients, so as not to keep patients or ambulances queuing. Roy is 66 years old and suddenly got pain in his back an hour ago. The paramedic brings him into the door at the other end of the initial assessment zone, where a nurse and an HCA see to him straight away. They call a GP to see Roy. The GP asks the A&E doctor for a quick ultrasound scan and everyone is pleased that Roy doesn't have an aneurysm. Roy gets a cannula and blood test from the nurse. The GP orders a urine dip and moves Roy to the majors area for an A&E doctor to order a CT scan to look for a stone, if the urine dip turns out to be positive. Kate is 64 and is seen in streaming by an A&E consultant. He thinks she had a TIA. The nurses do bloods and an ECG, then the A&E consultant sends her to the EDU area of A&E to sort out TIA clinic appointment and start her on medications. Max is 4 months old and has a temperature of 39 degrees. His mum is worried that he's clingy and he won't eat. He comes to A&E by car and as soon as he's booked in by the receptionist, he goes into the streaming area, where an experienced nurse or nurse practitioner trained in both A&E and paediatrics will assess Max. After spending a few minutes with him and doing his observations using our POP score, they will decide if he seems fairly well that he can be seen by a GP in the next door consultation room. If they're more concerned, they will get him seen by the paediatric A&E team. If very concerned, one of the paediatric A&E consultants or consultant paediatricians working alongside them in children's A&E will be called to see Max straight away. So you can see that the streaming service in children's A&E operates in much the same way as the streaming service for adult patients. This short video has hopefully explained that in the new A&E department there will be a fully integrated streaming process. All patients will enter an initial assessment zone, whether they arrive by foot, by car or by ambulance, and whether they are an adult or a child. They will have a quick assessment by a multidisciplinary A&E team, which includes GPs with specialist skills in A&E, who can send the patient home to their GP, request a longer GP consultation slot, or move them to other parts of A&E or UHL. This provides our patients with a swift and efficient service and makes sure our A&E and our wards don't become congested with patients who could be managed elsewhere. Thanks for listening.